Okay, welcome to everyone who has joined us today on our webinar. This is our monthly HBCU Learning Collaborative. Today's topic will be Building Coalitions to Promote Health Equity, a Toolkit for Action. We would like to thank you for joining us, and to welcome you, we will have our Director of Advocacy and Consumer Affairs, Winifred Quinn.
Great, thank you, Jasmine, and hello, everyone. Before I give the normal talking points as welcome, I want to give, on behalf of AARP and our members, a very heartfelt thank you to all of the nurses out there for your bravery and courage and steadfastness in helping all vulnerable populations, and especially in this time, this historic moment of public health emergency. So thank you, thank you, thank you. And thank you for joining today's Learning Collaborative. We are so excited to have Dr. Piri Ackerman-Barger joining us today to share the Future of Nursing Campaign for Action's newly developed Health Equity Toolkit. The Health Equity Toolkit provides tools, resources, and information that nurses, as well as action coalitions and their partners, need to help their communities by tackling the social determinants of health. Before we go further, I want to mention we are recording today's webinar, so if you miss a section or would like to pass it to a colleague, which we highly encourage you to do, you can find the recording by going to our website, www.campaignforaction.com/webinars. Now to Piri. And for the sake of time, Piri, I'm not going to read your full biography, but to all of you who are on the phone, once we post the webinar in the description, it will have Piri's full biography. Piri is one of our consultants for the Campaign for Action, and she is an assistant clinical professor at the University of California, Davis Betty Irene Moore School of Nursing. And she also serves as the co-director for the Center for a Diverse Healthcare Workforce and the Interprofessional Teaching Scholars Program. Piri, thank you so much for joining us today, and take it away.
Thank you, Wynn, and welcome everyone. Please change the slide. In a recent article, Perfectly Positioned, Galvanizing Nurses to Address the Social Determinants of Health, Dr. Susan Hass-Miller highlighted research showing that social and economic factors, such as access to high-quality jobs, education, and housing, have a greater impact on health outcomes than does the medical care a person receives. At nearly 4 million strong, nurses in the US are perfectly positioned to focus on and lead an effort to focus on strategies to promote health equity. Next slide. The Building Coalitions to Promote Health Equity Toolkit for Action is inspired by the Future of Nursing report from the Institute of Medicine. Commissioned by the Robert Wood Johnson Foundation, the Future of Nursing 2020-2030 consensus study from the National Academy of Medicine believes that the nursing profession, consistently ranked as the most trusted health professionals, can and should be called upon to address the important social and health inequities confronting the United States in the 21st century. Planned for release at the end of 2020, the study will help guide nurses and institutions to work together on better understanding and addressing social determinants of health and the unmet needs of individuals and communities. Next slide. This work is informed and guided by the Future of Nursing Campaign for Action's Equity, Diversity, and Inclusion Steering Committee, who are pictured here. This work is inspired by the belief that everyone, regardless of race, religion, creed, ethnicity, age, gender, sexual orientation, or any aspect of their identity, including where they come from and where they live and work, deserves to live the healthiest life possible. The Equity, Diversity, and Inclusion Steering Committee works closely with communities and thought leaders from across the country to identify barriers to health. Moreover, the committee engages communities by building bridges that leverage policy systems and that promote, drive, and sustain a culture of health and health equity. Next slide. By sharing resources and examples of community in action, we hope to facilitate community dialogue and meaningful partnerships that result in the identification of collective health goals that inspire concrete, actionable community initiatives that improve health outcomes. Next slide. The toolkit includes step-by-step instructions to use and navigate the document. The toolkit was designed to guide and support nursing efforts to address social determinants of health and to advance health equity in their communities. If you're not familiar with the social determinants of health factors, this toolkit is designed to provide step-by-step instructions on how to engage stakeholders and/or potential funders to address health equity. Each section is standalone, and it is best to start with the section that most applies to your coalition needs. Each section includes descriptions and definitions, introducing topics, current evidence, or best or promising practices and resources, including interactive webinars to inspire action. Next slide, please. The Health Equity Toolkit was designed to guide and support nurses in their efforts to address social determinants of health and to advance health equity in their communities. Although the toolkit was designed for nurses, it will benefit all healthcare providers, community members, healthcare stakeholders, businesses, healthcare facilities, consumer advocates, and anyone who is interested in creating meaningful healthcare changes in their community. Next slide. On the Campaign for Action webpage, you can find more information about the toolkit and a copy of the toolkit itself. We update the toolkit periodically as new resources are discovered and developed. The toolkit is organized using the acronym ADPI, which includes the 5 steps of the nursing process: assessment, diagnosis, implementation, and evaluation. And this slide right here is actually the page that comes up when you get onto our website. Next slide, please. This slide is a quick view of the topics and sections included in the toolkit. We recommend starting with sections 1 through 3, which includes a social determinants of health survey to assess nurses' knowledge, readiness, willingness, and capacity to take action on the social determinants of health in their practice setting. Based on the results, we offer interactive webinars and references for those who need more information. Section 1 provides an overview and purpose of the toolkit. Sections 2 through 7 provides a stepwise approach to moving an initiative or effort forward using the nursing process as a framework. And sections 8 through 9 include a resource hub and references. Let's do a deeper dive into each of the sections. Next slide, please. So section 1 is the overview and purpose. It also includes critical definitions for the toolkit, such as health disparities, health equity, culture of health. This ensures that teams are using consistent language while action planning. There's also a table that includes many of the social determinants of health within the framework depicted on this slide. As action coalitions review the social determinants of health included in the table, please note that this was not intended to be an exhaustive list. Instead, it includes some fundamental social determinants, some social determinants with updated terminology such as housing insecurity rather than the term homelessness. Housing insecurity reflects a broader understanding of how living conditions impact health outcomes. The table also includes emerging social determinants such as discrimination and social isolation. Next slide, please. Section 2 assesses your knowledge and preparedness to address social determinants of health. Consistent with the 5 steps of the nursing process, we recommend action coalitions conduct a self-assessment to determine their readiness and their needs for addressing social determinants of health. This process includes acknowledging and reflecting on existing work, efforts, and achievements through appreciative inquiry. Next slide, please. Still on section 2, Social Determinants of Health Assessment Survey has been updated with permission from Drs. Janice Phillips and Angelique Richard from Rush University Medical Center Department of Nursing Administration to fit the needs of state action coalitions. The survey includes 10 questions and takes less than 10 minutes to complete. The results may help determine action steps to begin or support health equity work. And this slide gives a little overview of what you might expect on that survey. Next slide, please. Section 3 is about the community assessment. Teams can use the resources on this slide, and where they're also included in the toolkit, to collect objective data related to community strengths and resources. This process is also called an environmental scan. This phase includes gathering information about community's challenges and resources. Ideally, participants who identify priorities are community residents, health professionals, and other local leaders. Nurses are in a unique position to conduct a community assessment because they often have firsthand knowledge of critical health needs of their patients and a community's experience. A community assessment will also highlight the assets, strengths, and resources within a community that residents can build upon. Obtain input from as many sectors as possible in the community when identifying the community's assets and strengths. Begin an inventory list to document these assets. These may include organizations, people, places, associations, coalitions, and institutions. Other sources of information are the internet, community websites, the Chamber of Commerce, local newspapers, and county health departments. Next slide. Section 4 has to do with social diagnosis and deciding. The value of addressing social determinants of health is reflected by how primary care and clinical settings are increasing efforts to link social determinants of health to the International Statistical Classification of Diseases and Related Health Problems 10th Revision Diagnosis, also known as ICD-10 diagnosis. So there are efforts to recognize this and to code them. In a community setting, once the assessment is completed, action coalitions or any coalition using the tool can work with partners and stakeholders to define and prioritize the social determinants to address. One simple recommendation made by the Community Toolbox, and you can find that in the Resource Hub, is to list all of the social determinants that your community is facing and form criteria that can help decide what action to take and when. This slide includes some criteria to consider when making decisions. Next slide, please. Section 5 is all about planning, and we'll have several slides on this. So community problems are often too complex for any one agency to address, making community engagement an essential step for developing community-based solutions and advancing health equity. Community engagement is a process that engages community members, organizations, institutions, and other relevant stakeholders to pursue solutions or interventions that address the issue at hand. Central to this process is recognizing community residents are the most important resource in the community. Relationship building with community members takes time and involves certain strategies. See the CDC's A Practitioner's Guide for Advancing Health Equity for Strategies on Community Engagement. And again, this resource can be found in the toolkit. On this slide, you'll see some points about identifying and engaging potential partners. And we listed some partners to consider. These are partners that the Campaign for Action works with a lot. And again, this is in no way meant to be an exhaustive list, just some ideas. Next slide. This is a slide, again, to help you think broadly about potential coalition membership. I keep emphasizing that it's not meant to be an exhaustive list, but this is really true, just food for thought. And so you'll see that there's anything from police departments to churches to professional organizations, thinking about hospitals and schools. All of these folks have engagement in health, and we need to remember that all policy is health policy. Next slide, please. This is a table that asks teams to plan and write out how they can and will reach out to potential champion stakeholders and team members. So this is basically the start of an actionable plan. So it asks you to think about who's the audience, What is the content that you would want to address? What is the communication format in media? And what are you going to say in that format? What are additional resources? And what is the timing of the communication? In other words, when are we going to call that person? When is the right time? Next slide. One of the most important steps in planning is to have clear shared goals. In the toolkit, we include templates to help establish SMART goals, which are the backbone of a strategic plan. For example, we recommend using the acronym SMART to create goals that are specific, measurable, achievable, relevant, and time limited. Next slide. In the toolkit, we include many links to learn about how to fundraise to support diversity work. All the links shown here can be found in the toolkit and are hyperlinked, meaning that you can click directly onto the web address to get to the website. And this is just a sample of what you'll find in the toolkit. Next slide. Section 6 is action and implementation. In the toolkit, there are hyperlinks with multiple examples of nurses in the field and in action. These examples are meant to serve as inspiration as teams brainstorm what can be done. These examples also include hands-on strategies that may be useful in implementing action plans. And please note that everybody's action plans are going to be different because your resources, your individuals, your needs are different. But there are multiple groups that have had successful plans. So go ahead and take a look at some of the examples that we've included in the toolkit. Next slide. So section 7 is about evaluating impact. As you plan and implement, it's essential to plan for measuring impact. So ask yourself some questions. First one is about recognition. What has changed in the issues of the community you hope to address? Replication. Could your strategy be replicated by another community? If so, how? And remember that this is all about sharing resources. So the more we can share our successes and key takeaways, the better it will be for everyone. Additional questions could be, what policy suggestions could you make as a result of your effort? This could be professional clinical guideline changes, such as having insurance coverage for screening social determinants of health, or maybe it's a hospital or workplace policy change. Consider both statewide, national, and federal changes to address this issue as well. We should think both locally and nationally. Another question to ask is, what health outcomes or health behaviors could or actually have changed as a result of your work? For example, maybe your efforts have increased physical activity rates in your community or increased vaccination rates. There are many references for guidance on the evaluation toolkit. One that might be particularly helpful is called Evaluating Strategies for Reducing Health Disparities by Addressing the Social Determinants of Health. And this is a 2016 article that was published in Health Affairs. Next slide. Section 8 is the resource hub, and that contains a list of additional resources that may help your teams with your endeavors. Please note that this is a living document. So if there's a resource that you know of and that has been valuable to you and is related to social determinants of health and health equity, please consider sharing it with us so that we can add it to the list. If you have something that you would like to share, Jasmine Cooper is the one that receives that, and you can see her email address here. Next slide, please. So this is the part where we're wanting you to break out into groups and start discussing. So when you break out into your groups, there are 3 different questions that are here. The first one is, what social determinants of health does your community face? And which ones are both priorities and actionable? And then, using the example from above, once you decide on one, identify potential partners and champions who could move this effort forward. And then, as you've made those decisions, craft a sentence or 2 about selling points that you might use to persuade potential partners and champions that this effort is worth investing in and would be of benefit to them or the community members or constituents. one thing to remember is that this is not something that you're committing to do. This is brainstorming. This is seeing how other people in your group might think, what ideas they have. We're hoping that you'll be inspired and then get a little bit of a sense of what the kinds of conversations we want you to have while you're using the toolkit. And from here, I'm going to hand it over to Jasmine to give you instructions about how to break up into your work groups.
Great, thank you, Piri. So what we're going to do is we're going to break you out into 4 groups now. There'll be a slight delay. It'll ask you if you want to join. Please accept that invitation, and then it will start the 10 minutes. Thank you, and we'll see you back soon.
Fabulous. So this is an opportunity now. We want to engage in discussion. So you can tell us what maybe came up in your breakout groups and what your thoughts and responses are to that. And this is also a time to ask questions and see if we can collectively answer those questions. So I'd like to open it up to others.
Perry, this is Pierre.
Hi, Pierre.
How are you doing?
Good. Nice to talk to you.
Same here. I was glad to be able to get on the call. Is anyone ready? We're group 4.
Yes, we're ready.
Delano, I'm sorry if I mispronounced, from Louisiana. You want to start out, be the reporter for our group?
Actually, my name is Delanor, and I'm
Delanor,
the one
I
from Kentucky.
apologize, please.
It's quite all right. We have such unique names on this call. It's lovely.
That's right.
And Cynthia is from Louisiana. And we started out by looking at things that were opportunities in all of our states, and came up with the one that we thought would be most actionable, and that was lack of access to immunizations.
Great.
And then using an example from the above questions, identify potential partners and champions who could move this effort forward. We came up with quite a long list, actually. Pharmaceutical companies, universities, drugstores, actually insurance companies, because we are an area that have a lot of healthcare entities. Students from nursing schools that are doing their theses, masters for nursing, and then DNP students as well. We also think that the opportunity to work with large companies that provide support to the aged, like we have Trilogy here in Signature. They might want to partner with us to ensure immunizations for their clientele as well. We didn't get to the last part in terms of crafting, because we had to figure out how to make this breakout session work. So we didn't get to crafting the 1 or 2 sentences or selling points that we might use to persuade potential partners.
But as a suggestion, we could even focus on the risk benefit of immunizations.
Absolutely.
People continue to cite the original study discussing how harmful immunizations could be, but we could come back with how beneficial it could be.
Right.
And because the most difficult part is to dissuade people from their value system. And but anyway, the best you can do at this point is to provide a risk benefits of immunization.
I think in working out a way to tell the stories of those who were not immunized, and the story of those who were immunized, to be able to share the story, to sell to people who may want to participate with us.
Beautiful. Thank you so much, Group 4. Were there other discussions? Group 1, Group 2, Group 3? Group 1, you there?
We did not have a group 1, but we can start with group 2 or 3.
Okay, group 2.
Group 2, hi, this is Devorah. How's everybody?
Good, hi Devorah.
Group 2, we talked about how kind of the first steps was really defining what our community is, because I know like here in DC, the ward that Howard sits in, it borders on different other wards. We serve a community that we don't necessarily sit in, if that makes sense. So we serve Ward 7 and 8. We're actually, I think, if I remember correctly, we're actually in Ward 2. So just really making sure that we narrow down who our community is. And then one of the things that I thought about was the fact that we have a lot of new building going on in this area, and that I wonder whether that's creating some housing insecurity for some of the residents, that longtime residents of the area, that may not be able to afford the housing that is being developed now. And so we kind of brainstormed about what partnerships might help with that, such as maybe Habitat for Humanity or HUD, what resources are available. We didn't get to, and I'm sorry, the person from Virginia, remind us what were some of the social determinants that you identified?
Yeah, good afternoon, everyone. This is Aretha Thurman. I'm here in Norfolk, Virginia. And so one of the things we identified, our community that I talked about was really our academic community here in the university. And hypertension was actually, the prevalence of hypertension was actually identified here because we had a human resource event where it was like a health fair kind of benefits kind of an event where our department actually conducted blood pressure readings, and 80% of the participants actually had hypertension, and not all of them were certainly being treated, and so that certainly is an issue. And so when we just think about partners, the American Heart Association, our clinical partners that we use here, and just like Devorah said, we didn't actually get to the question part, but when we think about you know, who the strategic buy-in, of course, you know, when you have that larger percentage of people who have hypertension in one setting, this can certainly impact even just employment here. Then, of course, would feed into the research that was mentioned in the presentation about that impacting the health of people. So I think that would be something that would definitely got me to thinking about issues here in our part of the country.
Wonderful, and that's really what this exercise is about, is to just get people thinking and brainstorming and talking about what's important in their neighborhood. I was in group 3, and in that group, we had representation from Alabama, Greensboro, Alabama. Is that right? Or in Tuskegee, I might have my states mixed up. DC, and then I'm in Sacramento, California. And we came up with like what seems like 3 separate things, but we started to see that they're all interrelated. The first one for DC was gun violence and the impact on the community and mental health outcomes from that. We talked about housing and homelessness in Greensboro, and then mental health issues in Tuskegee. And as we started to roll that back, it seems like all of those were somewhat interrelated. We were talking about maybe how, you know, whatever that social determinant is, when it overwhelms individuals and communities, there are mental health impacts. And when there's coping issues and all of those things, it kind of creates this big giant cloud. When we talked about potential partners, we got to social services and the governor's office, and it's a trend. None of us got to question 3, but at least we had plenty of material for a robust conversation. From group 3, were there points that you wanted to add to our conversation? Okay, so if there are no questions or comments, did we get all of the groups, Jasmine? Was it 2, 3, and 4?
Yes, we got all of the groups.
Excuse me, Perry.
Yeah, go ahead.
I just have a suggestion for, was it group 2?
Yeah,
In the divorce group.
yeah.
Yes.
If they can include Ward 5, which is a largely Hispanic group. We generally have historically we focused on Ward 7 and 8, which have traditionally been our underserved populations, but there's a large newly arrived population in the Hispanic communities in Ward 5. And some other partners that people had not identified on the call were the Black nurses, or not just Black nurses, but ethnically identifiable nursing organizations like the Black Nurses Association or the nursing sorority Chi Phi, or the Hispanic Nurses Association, Pacific Islanders Association, because these groups really have a direct contact with the communities that all of us serve. So if you're not familiar with the group in your area, really just ask around or go to the national associations and find out who to contact for the local chapter.
Beautiful. Thank you so much for that. Those are really good ideas. I want to open it up a little more broadly, question, answer, comment, or reaction about the toolkit itself and using it with action coalitions or community advocacy groups. What questions or comments or reactions do you have about the toolkit?
Hey, this is Aretha again from Norfolk. I don't have a question toolkit, but I want to thank you for the toolkit. I think it would be a good resource from what I can tell so far. So I think it's going to be really helpful, and just some future planning and some opportunities to think about how we're actually going to do this. So I thank you for that.
Wonderful. Yeah, I mean, we're at the very beginning stages of it, so we're definitely interested in getting feedback on usability and relevance and all of that. So thank you so much for participating today, and I'm going to hand it back over to Wynn.
I would like to also say that in Greensboro, we've already begun this process. We've had a partnership group meeting. 1 and number 2 is coming up on this Friday. So this toolkit is very useful, and I also appreciate it.
Thank you, Dr. Hoover.
Mm-hmm.
Hi, everyone. So thank you so much, Piri. Thank you. So it was, and Jasmine, thank you for all the navigation for Zoom. So, I mean, we're learning something all the time, right?
Yes, we are.
So, folks, thank you all for participating in today's conversation. If you have feedback for us on, Zoom and breakout sessions online is something new that we're newly navigating. If you have any experience with this and have any ideas, we are open. So there's an invitation as well as a thank you. So, and a reminder that we are recording today's conversation and webinar. If you would like to listen to it or pass it on to a colleague, which again, we hope you do, you can access the webinar and any related materials like the toolkit and Peary's biography by going to www.campaignforaction.org/webinars. Please join us on Twitter, www.twitter.com/campaign4action, and then on Facebook, facebook.com/campaign4action. Shoot us any emails with any ideas or questions, concerns, etc. So always happy to hear from you folks. And thank you once again for your courage and bravery in the middle of all that the world is going through right now. So thank you. Thank you, Jasmine.
Thank you so much for joining. Thank you.